talked about already, but we touch on, is the idea of tonify versus sedation, right? So when we are tonifying, right, we're strengthening, nourishing, supporting something that is deficient, weaker. So what you generally will find is the point, sometimes, again, just like with the pulse, sometimes it seems like it's excess because you feel a tightness on the surface. But then, so a lot of the time what happens is someone will sedate and it'll just stay tight because it doesn't feel safe, right? So understanding the difference, usually something that is excess is not flat and tight. It's more like round and tight, and usually it's a point, right? A trigger point or an acupoint or whatever you want to call it, and it usually has a more warm, kind of inflamed feeling to it, whereas something, if it's tight at the surface, but it's actually deficient, then it's usually this tight, flat, like really tight feeling. But then you go in and you wait, and then you wait, and then it goes, and you'll just feel it. It's just like sand, right? And it just opens up, and you almost feel like you're falling into the point. So, and then you have to give it time down there, like I said, and then sometimes you have to kind of ask it. Okay, let's be done. And it can be usually, and we'll later on, I'll let you guys feel this, but usually, like if it's an entire meridian that is deficient, it won't all be empty. It'll be uneven, right? But sometimes you can come across cases where you just feel the whole meridian, and it's like a groove, all the way down. But a lot of the time there'll be little areas where the energy has kind of gotten bunched up and congested, right? So the idea is not that you want to sedate that necessarily, but you want to spread it. So you're still doing it in a supportive way, so that, like Bahari talks about, in the Qigong, that you're kind of smoothing it out. And that's where, like, a lot of people, they want to learn acupressure and whatnot, but it's like, if you're not treating the entire meridian, and even with acupuncture a lot of the time, if you're not treating the meridian, the energy just, these are pools, right? Anatomically in the body, most of the points are grooves in the bone, or they're places where two tendons, the space between where two tendons meet, or they're attached, they're all in anatomical kind of gaps in the body. So if you're not like really smoothing out the meridian, it's just going to go back there, right? It's just going to go back. It's just like if you only treat someone's head for a headache, they may feel better for a minute, but if you don't send that extra chi somewhere, it's just going to go right back there, possibly even worse than before. So it's exactly the same thing. So you always want to make sure that you're doing it with intention. So this is slow, sustained pressure. It can be gentle. For some people, you're going to find that they are very, very pressure sensitive, and you really do just need to touch the surface, because going deeper is just going to knock them out. It's just going to tire them out. So, but sometimes working very, very lightly can be more effective than working deep. And I also find a lot of the time with deficient people, especially blood deficient people, they want you to go deep, right? They want to feel it, but you're like, no, like the body is, but they're used to walking out of it, feeling exhausted for 2 days, and then starting to feel better. So it's kind of like you have to retrain them. And honestly, I usually trick them a little bit. I usually find what is the most jitsu in the body, and then in that area, I'll do some more stronger treatment, like the way that they're used to being abused, and like, work stronger on that, and do, more strong dispersion, so then they still feel like they're getting what they want without me compromising.
Do your clients don't get undressed?
Well, if I'm doing acupuncture, yes, then I just But if I was doing straight shiatsu, like ideally they'd be wearing something like this. Yeah. But you can do it with shapes as well. It's just that some of it's a little bit like Thai massage in that like some of the stretches and stuff are, so draping can get challenging. Yeah. But generally speaking, yeah, people are usually wearing some kind of loose, comfortable clothing. Yeah, and again, we hold the pressure longer because it takes the deficient body longer to start to respond, right? That she is often moving more slowly or it's more chaotic and dispersed. So it just takes more time for it to come to the point where it needs to be. So an example, a client with kidney qi deficiency, right? Often you're going to have someone come in and they've got low back pain, maybe frequent urination or exhaustion. So we can be working kidney free, which also is good for the lung and good for the breathing, right? And then getting them to take some slow, deep breaths as we're applying that pressure. So sedation, right? So we're reducing, releasing, and dispersing excess overactive energy in an organ meridian or point. Now, it's not always that simple because, for example, we can have dampness, right? So if we look at stomach and spleen dampness, for example, spleen 9 is a really, really good point for that. You can't apply always deep pressure when there's dampness because it can be very painful. So then it would be more of a light dispersing, right? Like particularly spleen 9. Right? If you feel that point on yourself, in deeper there, you have to straighten your leg to really get in the point. Right? Oh yeah, like it's tender, right?
Yeah.
But just give it a, because if you essentially think about spleen 9 as it's lymph, right? It's fluid, and so this is such a good point for water retention. It's great, like if someone was on an airplane and they got swollen ankles and thought that on themselves. So sedating it is just a very kind of, it doesn't have to be deep, right? But you're moving it. So again, using the imagination, using the breath, and using the intention on the points, you're connecting with the point. And that's one of the things that's really difficult in acupuncture training and observing is they teach you all these points and then they're like, well, don't touch it. It's not plain needle technique to touch the point, just wipe it with alcohol and then put the needle. But how do you feel the energy of the point without touching it? And it's the part that acupuncturists, if they haven't already done some kind of a bodywork practice, that they are often lacking is that ability to actually connect with the meridians, connect with the energy of the body. And especially in cases where they don't even teach Qigong in the program. So it becomes so kind of medical and sterile, which is the opposite of really what it should be. So this is, a way to, connect with the meridians, connect with the body, and kind of ask the body what it needs, right? So quick dispersing, regular moving, shorter holds, and sometimes it can be a little bit deeper, and sometimes it can be lighter, again, depending on what meridian. If we're working on the gallbladder meridian, stomach meridian on the legs, a much deeper pressure than the bladder. Well, the bladder, sometimes you can go deeper, but if you're on a yin meridian, definitely not, right? Like if you're dealing with dampness, or even blood stasis, again, depending on the location and the point. But if it's on a yin meridian, probably you're not working so deeply. However, something like liver qi stagnation, right? If we were talking about dispersing liver 3, now again, can be, it's liver, it's a yin quite tender, but you would work that more deeply than, for example, spleen 9, right? Because it's kind of a deep point in the bones, and it's more to do with the blood, which is a deeper level than right? But we want to release it. If we're needling, of course, when we're tonifying, we're going in, we're going nice and slow, and if we're sedating, we're more quick and lifting. So then there's the types of pressure. So we already sort of touched on the palming pressure, right? Often using the breath, trying to connect the breath. Client's breath, staying relaxed, not forcing, right? Connection, grounding, intention, right? When we touch a point, we're not touching the surface of the body. We want to go to the bottom of the point. We always want to go in with a soft mind, right? If you go in intense, it feels intense. Go in with a soft intention to the bottom of the point. Feel what the body is giving you back. And again, you know, your depth is adjusted based on what the tissues are telling you, what the client's telling you with their breath, and somewhere in there probably your intuition is responding to that as well. So we'll go over these with a little bit of practice as well. So first of all, stretching with support. So very similar to the palming, right, where we're, as I mentioned, like supporting the shoulder and then stretching the limb, right? And maybe at the beginning, a little bit of dynamic stretching, some movement, get things moving a little bit, and then a sustained stretch. And we never want to go past the end field. We never want to go past the point of resistance, right? We stay at the point of resistance, and then as it gives in, right, releases, then you go a little bit deeper. Some people can go like 3 levels of dropping out when you just stay at the point of resistance, whereas if you just pull, usually they stay where they are and you don't get to the next levels. So again, and that's about that supporting hand and that active hand working together to allow the body to relax into the work that you're doing. Yeah, so, and whether that's supporting the shoulders, right, rotating the wrist, you're supporting at the wrist, whatever joint you're working on, you want your supporting hand to be proximal to the center of the body. And palm pressure, you know, we just did that, so broad even pressure, support with the other hand. And again, very good for warming up the large muscle groups, but also a fantastic assessment tool. Right, I'm sure you notice as you're working on people, oh, it's tighter here, oh, it's softer here, right? So you start to get that impression of where it is that you're going to need to focus when you go into the next level, right? Thumb beside thumb. So again, thumb beside thumb, especially if you have, you know, neck and shoulder and wrist problems, you really just want to make sure that you're keeping everything soft and you're not pushing. You're using coming from your core, perpendicular, and using body weight and intention, right? It doesn't take a huge amount of pressure. Now, perfect example is doing thumb work down both sides of the spine at the same time. You can also do one side at a time. And then thumb on thumb, it's just like when we were talking about doing this, that the middle finger supports the index finger. Same with thumb on thumb. So you're going to put your whatever dominant thumb on the bottom, and then your top thumb is just supporting that one. So this becomes basically the mother that's on top of the child. So it's like, you know, the mother is holding the child's hand.
Didn't like it.
Big Steve wants So we'll go through all of this. Again, when we're applying elbow pressure, the mother hand is in the region. So if we're on the upper back, it needs to be supporting the shoulder. If we're on the low back, it can be supporting the hip, the pelvis, and 90 degrees with the body weight. And of course, the elbow allows us to go a little bit deeper. And also we can apply broad pressure by straightening the elbow out. We can give a more direct pressure by bending the elbow in. And you want to make sure that you're going in with gravity and you're not forcing because it can be painful. And of course, ever the more important to make sure that you're focusing into the bottom of the point so that you're not pushing the bone or hurting the client. So we've talked about this a whole bunch, but intention is such an important part of the treatment. And this has been on my website and my tagline for my entire career, right? Where the mind, except that I have a typo there that I'm staring at. Where the mind goes, the chi will follow. Right? So the Yellow Emperor's classic of Chinese medicine, and it can apply to so many things in life. So really learning about how our thoughts create our reality. And yeah, there's been lots of iterations of that over time. But setting an intention, I learned, I think I told you like early on in my practice that I was like taking on a lot of energy from practicing in clinic and my clients. And so that was one of the things that I had to learn as I created all of these different bubbles of safety, which was my intention, right? First, do no harm. That's do no harm to me, that's do no harm to you. And an intention that protects the treatment space, that the client feels protected and has their best interests in mind, that I am protected and safe and not being injured, that, we're present, that the best outcome, not income, that for the best outcome in that moment rather than an unrealistic goal, and helping our clients understand whether their goals are realistic or not, or a time frame for those goals. So those are all things that we can focus on when we're doing intention. It's a really, 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 really good thing to practice. Like, even working with, I want you guys to write out, like, your intention in your own words, sort of based on that information, and start to practice as something that you can always change, right? You can always change the wording, you can always shift it slightly, but also it doesn't hurt to experiment a little bit at the beginning and say, okay, well, I want my intention to be blah, 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 and see how it works, but then change it and see if, I want to serve my client's needs. Okay, I want to serve my needs, and playing with it to see how the treatments and the outcomes and your mindset shift is really, really interesting. So, and there have been times, when I've done fairly major shifts to my intention, largely because at the beginning of my career, there was no me in my intention. There was only my client's well-being, my client's health, and then of course burnout followed. And so, it's that idea, yes, you do have to put on your gas mask first, of course. If you have nothing to give, no one benefits. So, yeah. So feeling what feels right for you, or words that resonate for you, just take a minute and kind of writing a couple couple of those things down,